LaTanya Johnson, and I represent Milwaukee's 6th Senate District located on Milwaukee's north and northwest side. Welcome to our town hall, which is one of just many programs being sponsored by the Black Legislative Caucus for Black History Month. February 15th through 19th is Health and Mental Health Week, and I have had the amazing honor of working with two of my fellow colleagues and Black Caucus members to put together this week and its programming. These individuals are State Representative and Black Caucus Chair, Sheila Stubbs. Representative Stubbs represents Madison 77th Assembly District. She was first elected to the Assembly in 2018 as the first African American to represent Dane County in the state legislature. She is also a member of the Dane County Board of Supervisors, where she represents the 23rd District. Next is State Representative Supreme Moore Amakunde, which represents Milwaukee's 17th Assembly District, and he is my state representative. He is currently in his freshman term, elected to office in 2020 during one of the most challenging campaign cycles in our state's history. Prior to being elected to the state legislature, Representative Moore Amakunde was a member of Milwaukee County's Board of Supervisors, where he represented the 10th District for over 5 years.
Thank you, Senator.
Thank you.
Beautiful, Senator.
Thank you. And now we're going to talk about just a little bit about the webinar format. Throughout the webinar, participants will have the opportunity to ask questions to the panelists. After each presentation, one attendee question will be selected from the question and answer box for the speaker to answer, kind of like a clarification question. The Q&A box is located at the bottom of the Zoom webinar platform. Once the final presentation has been completed, I will moderate a brief question and answer with the panelists by selecting attendee questions submitted through the question and answer box. So please feel free to put your questions in the box so they can be answered throughout the program. Now I have the honor of introducing three of our awesome panelists. First, I will introduce Dr. Tito Izzard, President and CEO of Milwaukee Health Services Incorporated. Dr. Izzard is a Milwaukee native and is consistently voted one of Milwaukee's best family physicians. He has 20 years of experience as an educator, instructor, and chief administrator of medical practices with an emphasis on urban health issues, clinical practice redesign, and reducing health disparities. He is currently the president and CEO for Milwaukee Health Services Incorporated, an independent, non-for-profit, federally qualified health center. His comprehensive health facilities provide medical, dental, and behavioral health services for economically disadvantaged families. Dr. Izzard has recruited more physicians and underrepresented ethnic minority practitioners than any other healthcare practice in Wisconsin, allowing his organization to become one of the most diverse group practices in our state. Dr. Izzard received his BA in social work from Marquette University in 1992. He was Marquette's first social worker to become a physician. Dr. Izzard matriculated to the University of Wisconsin School of Medicine and Health, receiving his medical degree in 1996. Next, we'll have Lillian Payne. She is Chief of Staff for the interim City of Milwaukee Health Commissioner. Ms. Payne is the pioneering Chief of Staff for the City of Milwaukee Health Commissioner. Prior to returning to the Health Department, Ms. Payne served in a variety of roles across the public health sector, where she has championed social justice and health equality. Ms. Payne was instrumental in authoring the Wisconsin Public Health Association Racism is a Public Health Crisis in 2018 resolution. She facilitated the resolution adoption in Milwaukee, which marked the first municipality to do so. She currently holds the consecutive record for WPHA presidential citation for these outstanding contributions, the first in 2019 as a member of the Racial Equity Work Group, and second in 2020 as an individual person. Ms. Payne is an appointed member of the Governor's Health Equity Council. The YWCA of Southeastern Wisconsin awarded her the Face of the Future for Public Health in 2020. At the Milwaukee Health Department, Ms. Payne is responsible for representing the Health Commissioner's Office, upholding the mission and vision of the department, and liaisoning with key internal and external constituents. To this role, she brings experience facilitating partnerships for public health solutions throughout the city and a commitment to health and well-being of urban families. Ms. Payne received a Master's of Public Health degree as a premier graduate of the UW-Milwaukee Zilber School of Public Health. She is a Milwaukee native and resident also. And last but not least, we have Karen Timberlake, Interim Secretary for the Wisconsin Department of Health Services. Karen Timberlake returns to the Department of Health Services after 10 years away from government services. She most recently worked at Michael Best Strategies, supporting initiatives in healthcare and human services transformation. Before that, she directed the Population Health Institute at the University of Wisconsin School of Medicine and Public Health, worked to ensure higher quality healthcare at a lower cost with the Wisconsin Health Information Organization, and was Assistant Attorney General with the Wisconsin Department of Justice. She served as Secretary at DHS from 2008 to 2010, guiding Wisconsin through the H1N1 pandemic virus response. And to those who know Karen best, they say that she's the boss. So with that being said, I would like to start with our panelist presentations, and we will start with Dr. Tito Izzard.
Thank you, Senator Johnson, and our elected officials here. Really appreciate the opportunity to have this conversation and discussion, and plan to learn a lot from the other presenters also. So what I'm going to do is share my screen and try to make sure we stay on time. So we're going to talk today, and are you able to, yeah. All right, so we're going to talk today about Black health and white profit and the history of America's malignant miseducation regarding